everyone, and welcome back to the third episode of this podcast series, Heart Health with Dr. Rohit Sane. I am your host, Dr. Aman Kapoor, welcoming you all to the first episode of this new year 2024. Let's welcome this year with right habits and the right direction for having a healthy life and a healthy heart. Dr. Sane, welcome back to the first episode of 2024, and in this episode we are going to discuss about an important topic that often bothers and confuses everyone: cholesterol. So Dr. Sane, let us begin this episode by understanding from you. Please guide us. What is the role of cholesterol in the overall health, and specifically what is the importance of cholesterol when it comes to heart health? Over to you, sir.
Now, if at all the question is about cholesterol, we need to understand the concept of cholesterol very well. I am sure that till today you must have heard n number of concepts of cholesterol related to good cholesterol and bad cholesterol. As you must be knowing, there is a concept called as total cholesterol, and a division of that total cholesterol goes into good and bad cholesterol. Good cholesterol is nothing else but HDL cholesterol, and bad cholesterol is nothing else but LDL cholesterol. That is what you all must be knowing. But now we need to understand the actual concept of cholesterol, whether it actually affects the heart or not, whether it actually leads to any disease or not. Now, to understand this, we need to understand the whole cholesterol manufacturing process in our body, in which you are exerting yourself, or else you make your intestine exert a lot with high calorie food or high fatty food or high carbohydrate food. If at all this kind of stress, whatever type of stress you could be going through, any kind of stress would lead to a process called as oxidation in our body. Now, what do you mean by oxidation? Oxidation is nothing else but the oxygen molecule which gets into a transformation and creates a nascent oxygen. Usually you must be knowing that O2 is the chemical formula of oxygen, and whenever there is a nascent oxygen, that is single O, that becomes a nascent oxygen, which is nothing else but a devastating agent. If at all this nascent oxygen is released in our body, this nascent oxygen is responsible for all the damages that happen inside our body. As soon as this nascent oxygen goes and starts damaging the internal lining of the blood vessel, which is called as endothelium, there are cracks which get developed inside these blood vessels. As soon as the body recognizes these cracks inside the blood vessel layer, which is called as endothelium, there is a response in our body which goes and heals up this endothelial layer inside your blood vessel, and this healing agent is nothing other than your cholesterol. So every tissue, every cell of your body has the right to manufacture its own cholesterol to keep the cell themselves healthy. So this cholesterol is nothing else but the cement of your body. It's an repairing agent of your body, and cholesterol is nothing else but the savior for your body to prevent as well as to heal up from the damages that happen in your body. Now, you must have understood when does your body secrete or when does your body manufacture a lot amount of cholesterol is during some kind of stress. Either it could be a physical stress or else it could be a psychological stress. So as soon as that cholesterol gets manufactured in your body for the healing process, once the healing gets completed, the body should have stopped the manufacturing of cholesterol if the stress would have disappeared. But in certain people, the stress becomes chronic in nature. In all those people where the stress was acute, the healing process stops after a certain period of time. But if at all the individual is into a chronic status of stress which goes on for a long amount of time, the brain directly gives an open purchase order to the liver to manufacture the number of cholesterol, n number of cholesterol gets manufactured by the liver because of this open purchase order which it has received from the brain, and the cholesterol that gets manufactured in the liver to a very high level, this high level of cholesterol constantly stays in your blood as a repairing agent, and that high level of cholesterol is been considered as a problematic feature which goes and gets entrapped inside these endothelial cells inside the blood vessel, which is later recognized as blockages in your heart arteries. Now, to understand this well, if at all you are supposed to reduce down these elevated levels of cholesterol, or else you want to reduce down the manufacturing that is being considered as the problematic agent inside the body, inside the liver, if you want to reduce down the levels of elevated cholesterol, the only thing is to come out of the stressful situation. If at all you come out of this stressful situation, whether it's a lifestyle oriented stressful situation or whether it is something else or a psychological kind of stress that you are into, if you come out of this whole situation, your cholesterol levels will come back to normal by themselves. So just to understand whether cholesterol is the villain or the hero in this story, I would say cholesterol is neither the hero nor the villain. It was a person in whom this whole problem, this whole situation had began with. If at all you understand, cholesterol is a savior of your body. We are supposed to reduce down the stress which normally leads to production of this cholesterol, and if you understand this whole story, you would not consider cholesterol as the whole villain in this whole story.
Wow, that's a revelation, Dr. Sane. Thank you so much. Now, coming from this to the next question, when the cholesterol levels are raised in the body, do people need to take medicines to lower the cholesterol levels?
Okay. Yes. Now, if at all you understand, medicines can be of several different types which can be prescribed in a patient with elevated cholesterol levels. Now, these medicines could be n number of mechanism of action that they will be expected to do with. The first medicine that we know very commonly used to reduce down the elevated levels of cholesterol is nothing else but statins. How do these statins work? Statins are known to stop the chemical reaction called as HMG-CoA reductase inhibitor. They inhibit these HMG-CoA enzymes inside the body, which is responsible for cholesterol manufacturing inside the liver. In simpler terms, the liver, which is the manufacturing factory for your cholesterol inside your body, these statins directly tell the liver to stop the cholesterol production in your body rampantly. As soon as these statins enter inside your body, they shut down the manufacturing plant inside the body, that is your liver, and then you are into a position where the cholesterol will not be manufactured at all. Now you need to understand whether this is a good thing or whether this is a bad thing, because cholesterol was required for the repair that should happen inside your body, inside your blood vessels. Now just understand, if at all the liver doesn't manufacture cholesterol, enough cholesterol in your body, the repair work would not be completed and there would be n number of damages that could lead to n number of complications in our body. So if at all you are supposed to manage your cholesterol levels with very good medicines, the best kind of medicine that can help you to reduce down the elevated cholesterol levels is nothing else but your lifestyle and foods which are high in antioxidants. If at all you have a good source of antioxidants in your body, whatever oxidation which led to the damage, which led to the cholesterol manufacturing, if at all you would have had those kind of antioxidants, the oxidation could have been prevented. So a lot amount of antioxidants can be consumed in your food as well as through medicines. So if at all you concentrate on consuming these antioxidants through your food and having a good healthy lifestyle in which the stress can be addressed in a positive manner, you will be able to keep your cholesterol levels in normal levels and would not lead any kind of further complications, neither because of liver damage, neither because of elevated cholesterol levels. So that is how you can address this issue of elevated cholesterol levels through antioxidants and lifestyle change.
That is indeed eye-opening, Dr. Sane. Thank you so much for sharing such vital information about cholesterol and how to manage cholesterol levels. And it has really opened a lot of eyes, I'm sure, and a lot of people have got a fantastic insight from what you have guided us so far. Friends, in this episode, we have covered an important topic which was asked by a lot of you, and I hope you have got a fantastic insight about cholesterol, how to manage it, what to do about it, and what is the best way to keep your cholesterol levels normal. As we end this episode, once again, we wish you a fantastic new year. Have a great year ahead, a very healthy one. Let your and your loved ones have a fantastic health. My dear friends, remember, listening to this episode is just one part you can do for yourself. The second part is to spread this information to the loved ones that you know. Share this podcast, ask the questions in the comments below, subscribe to the podcast series, and spread the message of good health to everyone. With this, we take leave for this episode. Till the next episode, stay healthy, stay fit and fine. And I, Dr. Aman Kapoor, take your leave. Bye-bye. See you.